Are you struggling with a health condition and finding it difficult to make ends meet? What if I told you that you could be eligible for a £737 payment from the Department for Work and Pensions, but you don't even know it? Thousands of people across the UK are missing out on vital financial support simply because they are unaware that their health condition qualifies them. Did you know that there are actually 85 different health conditions that could make you eligible for this crucial financial support? Stay with me for the next few minutes, and I'll reveal the full list of conditions that could put money in your pocket this month. Could your condition be on this list? Let's find out together. Before we dive into the complete list, make sure you hit that subscribe button and turn on notifications so you never miss out on important updates about benefits and payments you might be entitled to. If this video helps you discover benefits you didn't know about, that subscription could literally pay for itself hundreds of times over. And if you know someone who's struggling with any health condition, share this video with them. It could make a huge difference in their life. Now, let's get into the details that could change your financial situation for the better. First, let's clarify what we're talking about. The Department for Work and Pensions, or DWP, provides personal independence payment, PIP, to help with extra living costs if you have a long-term physical or mental health condition or disability that makes daily activities or getting around difficult. PIP has replaced the Disability Living Allowance for adults aged 16 to state pension age. The monthly standard rate for the daily living component is approximately £737, which can be a lifeline for many. But did you know that PIP isn't means tested? That means your income, savings, and whether you're working or not don't affect your eligibility. So who exactly qualifies? You might be surprised to learn that it's not just about having a specific diagnosis, but rather how your condition affects your daily life. However, there are certain conditions that commonly qualify people for this support. Let me break it down for you in detail. Let's start with mental health conditions. Did you know that anxiety, depression, and stress-related disorders are among the most common conditions that qualify for PIP? Many people suffering from these conditions don't realize they could be eligible for financial support. The DWP recognizes that mental health can impact your ability to function day to day just as significantly as physical conditions. This includes conditions like post-traumatic stress disorder, obsessive-compulsive disorder, bipolar disorder, schizophrenia, and personality disorders. Have you been struggling with your mental health but assumed you wouldn't qualify for support? Think again. What about neurological conditions? Conditions like multiple sclerosis, Parkinson's disease, epilepsy, and motor neuron disease often qualify for PIP. Have you been diagnosed with one of these conditions but haven't applied for benefits? You could be missing out on crucial financial support. Other neurological conditions on the list include cerebral palsy, Huntington's disease, stroke, traumatic brain injury, and essential tremor. Even conditions like migraines, if severe enough to impact your daily functioning, could potentially qualify you for support. Respiratory conditions such as cystic fibrosis, asthma, and chronic obstructive pulmonary disease, COPD, are also on the list. Many people with these conditions struggle with daily activities due to breathing difficulties but don't realize they could qualify for extra support. This category also includes conditions like pulmonary fibrosis, emphysema, bronchiectasis, and sleep apnea. Are you constantly struggling to catch your breath and finding everyday tasks exhausting? PIP might be available to help ease your financial burden. Cardiovascular conditions like heart disease, angina, and heart failure can significantly impact your ability to carry out everyday tasks. If you're living with one of these conditions, you may be eligible for PIP, even if you're still able to work. This also includes conditions like arrhythmias, congenital heart disease, heart valve disease, and hypertension if it severely affects your daily life. Have you had a heart attack and are now struggling with recovery? You might qualify for financial assistance. For those with musculoskeletal conditions, including arthritis, back pain, and fibromyalgia, PIP can provide essential support. These conditions often cause chronic pain and mobility issues that make daily life challenging. Have you been trying to cope without additional help? Other conditions in this category include osteoporosis, ankylosing spondylitis, chronic fatigue syndrome, lupus, gout, and connective tissue disorders. Even if your condition fluctuates with good days and bad days, you could still qualify based on how it affects you overall. Sensory conditions affecting vision or hearing are also eligible. Are you partially sighted or deaf? PIP could help cover the additional costs associated with these conditions. This includes conditions like macular degeneration, cataracts, glaucoma, retinitis pigmentosa, MNI raised disease, and tinnitus. Do you use hearing aids or visual aids? The costs of maintenance and replacement can be significant, and PIP can help with these expenses. Gastrointestinal conditions like Crohn's disease, ulcerative colitis, and irritable bowel syndrome can be debilitating and unpredictable. The DWP recognizes the significant impact these conditions can have on your ability to lead a normal life. This category also includes conditions like diverticulitis, gastroesophageal reflux disease, GERD, celiac disease, and chronic liver conditions. Does your condition mean you need frequent, urgent access to toilet facilities? Does it restrict your diet significantly? These factors could qualify you for support. Have you been diagnosed with a skin disease or cancer? These conditions are also on the list. Skin conditions like psoriasis, eczema, and dermatitis can cause significant pain and discomfort and affect your ability to work and socialize. Cancer treatments like chemotherapy and radiotherapy can have debilitating side effects that impact every aspect of your life. Are you receiving treatment for cancer or recovering from treatment? You could be eligible for PIP during this challenging time. Autoimmune conditions are also recognized. This includes conditions like rheumatoid arthritis, multiple sclerosis, which we mentioned earlier, lupus, Crohn's disease, and HIV. These conditions can cause a wide range of symptoms that affect multiple body systems and can significantly impact your quality of life. Have you been diagnosed with an autoimmune condition and finding it harder to manage everyday tasks? PIP could provide the financial support you need. Endocrine conditions like diabetes, both type 1 and type 2, thyroid disorders, and Addison's disease can have far-reaching effects on your daily life. Are you struggling to manage your diabetes and finding it affects your energy levels and ability to complete daily tasks? You might be eligible for PIP. Neurological disorders that affect cognitive function, such as dementia, Alzheimer's disease, and Parkinson's disease, can severely impact independence and daily functioning. If you or a loved one is in the early stages of dementia and needs assistance with daily activities, PIP could provide vital financial support to help maintain independence for as long as possible. Let's talk about the specific assessment criteria. It's important to understand that the assessment for PIP focuses on how your condition affects you rather than just what your condition is. The assessment looks at two main components: daily living and mobility. For the daily living component, do you need help with activities like preparing food, eating and drinking, managing treatments, washing and bathing, using the toilet, dressing and undressing, communicating, reading, socializing, or managing money? These are the kinds of questions that determine eligibility for the daily living component of PIP. For the mobility component, do you need help planning and following a journey, or physically moving around? These questions determine eligibility for the mobility component of PIP. Each component has two rates, standard and enhanced. The rate you receive depends on how severely your condition affects you. As of 2024, the standard rate for the daily living component is approximately £68, 10p per week, about £295 per month, while the enhanced rate is about £101, 75p per week, about £442 per month. For the mobility component, the standard rate is about £26, 90p per week, and the enhanced rate is £71 per week. If you qualify for both components at the enhanced rate, you could receive up to £172, 75p per week, which is around £737 per month. The application process involves several steps. First, you'll need to contact the PIP claim line to start your application. They'll ask for basic information like your name, contact details, national insurance number, and bank details. Then, you'll be sent a form called How Your Disability Affects You. This is where you'll need to provide detailed information about how your condition affects your daily life. It's crucial to be thorough and honest when filling out this form. Many people make the mistake of only describing how they feel on their good days, but it's important to explain how your condition affects you on your bad days too. Do you have days where you can't get out of bed? Days where the pain is so severe you can't concentrate? Days where your anxiety makes it impossible to leave the house? These details matter for your assessment. After submitting your form, you may be invited to an assessment with a healthcare professional. This could be in person, over the phone, or by video call. The assessor will ask questions about your condition and how it affects your daily life. They'll then use this information to determine whether you qualify for PIP and at what rate. Many people find the assessment process stressful and intimidating. Here's a tip: consider keeping a diary for a week or two before your assessment, noting down how your condition affects you each day. This can help you provide specific examples during your assessment and ensure you don't forget important details. If your application is successful, you'll receive a letter telling you how much you'll get and for how long. PIP is usually awarded for a fixed period, after which you'll need to be reassessed. However, if your condition is unlikely to improve, you may be given an ongoing award with less frequent reviews. If your application is unsuccessful, you have the right to challenge the decision. First, you can ask for a mandatory reconsideration, where the DWP will look at your case again. If you're still not happy with the decision, you can appeal to an independent tribunal. It's worth noting that getting help with your application can significantly increase your chances of success. Organizations like Citizens Advice and disability charities can provide valuable support throughout the process. Have you considered reaching out to these organizations for help with your application? Now you have a better understanding of the types of health conditions that could qualify you for a £737 payment from the DWP. Remember, this isn't about trying to claim something you're not entitled to, it's about ensuring you receive the support you're legally eligible for during difficult times. Statistics show that many people who could qualify for PIP never apply, simply because they don't realize they're eligible or they find the application process too daunting. Don't let that be you. If you think your health condition affects your daily life in the ways we've discussed, it's worth applying for PIP. If you think you might qualify based on your health condition, don't wait another day. Visit the government.uk website or call the PIP claim line to start your application. The sooner you apply, the sooner you could receive the financial support you need. And remember, if your condition worsens over time, you can always request a reassessment to potentially qualify for a higher rate. Did you find this information useful? Let me know in the comments if you've applied for PIP or if you're planning to after watching this video. Have you been receiving PIP for a condition I didn't mention? Share your experience in the comments to help others. And don't forget to like and share this video with anyone who might benefit from this information. Thanks for watching, and I'll see you in the next video where we'll be discussing how to navigate the PIP assessment process successfully and providing tips on how to best describe how your condition affects you. Hit that subscribe button to make sure you don't miss it. Your financial well-being could depend on it.